NCLEX RN Questions and Answers 2026 to help you master the exam format. Question 1. Nurse Josie should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? Option A. Dairy products. Option B. Vegetables. Option C. Grains. Option D. Broccoli. The correct answer is option A. Dairy products. Vitamin B12 is found naturally in animal products, including meat, eggs, and dairy. It is absent in plant foods. Question 2. Karen has been diagnosed with aplastic anemia. The nurse monitors for changes in which of the following? Option A. Bowel function. Option B. Peripheral sensation. Option C. Bleeding tendencies. Option D. Intake and output. The correct answer is option C. Bleeding tendencies. Aplastic anemia involves pancytopenia, a low platelet count. Thrombocytopenia leads to significant bleeding tendencies. Question 3. Lydia is scheduled for elective splenectomy. Before the client goes to surgery, the nurse in charge's final assessment would be: Option A. Signed consent. Option B. Vital signs. Option C. Name band. Option D. Empty bladder. The correct answer is option B. Vital signs. A final set of vital signs provides the baseline for the surgical team and ensures the patient is stable enough to proceed. Question 4. What is the peak age range for acquiring acute lymphocytic leukemia, ALL? Option A. 4 to 12 years. Option B. 20 to 30 years. Option C. 40 to 50 years. Option D. 60 to 70 years. The correct answer is option A. 4 to 12 years. ALL is the most common childhood malignancy, with a peak incidence occurring between the ages of 4 and 12 years. Question 5. Marie with ALL suffers from nausea and headache. These clinical manifestations may indicate: Option A. Effects of radiation. Option B. Chemotherapy side effects. Option C. Meningeal irritation. Option D. Gastric distension. The correct answer is option C. Meningeal irritation. In ALL, leukemic cells can cross the blood-brain barrier, leading to meningeal irritation and increased intracranial pressure. Question 6. Which of the following is contraindicated for a client diagnosed with disseminated intravascular coagulation, DIC? Option A. Administering heparin. Option B. Administering Coumadin. Option C. Treating the underlying cause. Option D. Replacing depleted blood products. The correct answer is option B. Administering Coumadin. Coumadin is a long-term oral anticoagulant and is not used in the management of acute DIC. It would be inappropriate and potentially dangerous. Question 7. Which finding is the best indication that fluid replacement for the client with hypovolemic shock is adequate? Option A. Urine output greater than 30 milliliters per hour. Option B. A respiratory rate of 21 breaths/minute. Option C. Diastolic blood pressure greater than 90 mmHg. Option D. Systolic blood pressure greater than 110 mmHg. The correct answer is option A. Urine output greater than 30 milliliters per hour. Urine output of 30 ml/hr or more is the gold standard indicator of adequate organ perfusion and successful fluid resuscitation. Question 8. Which of the following would the nurse include in a teaching plan as an early manifestation of laryngeal cancer? Option A. Stomatitis. Option B. Airway obstruction. Option C. Hoarseness. Option D. Dysphagia. The correct answer is option C. Hoarseness. Persistent hoarseness is the most common early sign of laryngeal cancer due to the tumor's effect on the vocal cords. Question 9. Immunosuppressive therapy for myasthenia gravis is effective because it: Option A. Promotes the removal of antibodies. Option B. Stimulates acetylcholine production. Option C. Decreases production of autoantibodies. Option D. Inhibits the breakdown of acetylcholine. The correct answer is option C. Decreases production of autoantibodies. MG is an autoimmune disease where antibodies attack acetylcholine receptors. Immunosuppression lowers the count of these autoantibodies.